We've got 5 minutes, so who has the best question? No, I don't know. Okay, go ahead, yes, all right.
My question is, how would Medicare for All possibly affect the quality of medical care in this country?
I will look to the physicians on the panel to answer that.
If you let it be evidence-based and it's good access. If you let it be evidence-based and objective in the model of Express Scripts and a lot of these other things, I think it should actually improve care.
But apparently right now it's not evidence-based because you've got doctors performing things that are not evidence-based.
So I'll give you a data point of why I think Medicare for All would be profoundly better on quality of care. And to me, the most important measure of the outcome of a healthcare system is life expectancy. There are many things that feed into life expectancy other than the healthcare system. But we have this really interesting experiment on life expectancy between us and Canada. So before 1971, our life expectancies and Canadians' life expectancies were just a few months apart. Over years, if you could track it every year, for years we were the same. So the demographics of Canada, the regionalization of Canada, the differences between whatever and whatever, or the hidden language of racism, all of that, we were the same. And then in 1971, Canada fully implemented essentially Medicare for All. They even call it Medicare. In 1971, they put that in place, Medicare for all in all of their provinces. And in 1973, we put in place the HMO Act, creating managed care. Since that time, chugging along the same way in life expectancy, it separated. We were the same, and then it separated starting in 1971. So that we were the same, and now Canadians live 3 years longer than we do. Another data point, if I can give you one more. African Americans die 4 to 6 years younger than white Americans do. If you put them on, when we get onto dialysis, and we're all then the same insurance, we all have Medicare, African Americans live longer than white Americans do. If you look in the VA, where everybody has the same insurance, African Americans live longer than white Americans. So when you normalize for the insurance, when you give everybody robust, good access to health care, the quality, there's all kinds of micromanagement arguments about this that we can go into if you want, but if you look at the broad picture, the data shows from a broad perspective, when you give the population robust, good health care, guess what? The quality outcomes improve dramatically. So yes.
Since we have a little time, could you talk about what would be the best direction between now and 2020 with regard to the politics of either supporting Medicare for All or some other kind of version Ken mentioned?
Can I say something that'll surprise you? So between now and the end of the primary season, I think it's incumbent to push as hard and fast, as strong as we can for Medicare for All. And if at the end of the primary season, we have a candidate who's running on Medicare for All, woohoo, great. If we don't, if at that point we have a candidate who's running on what Ken's proposing, or some other program, or I don't frankly give a darn what they say about health care. If we have a candidate that could beat the jerk that's in office right now, and they could, I don't care what they run on. Almost, I'm overstating my point. At that point, at the end of the primary season, shut the hell up about this docket if we didn't win. And fix it and win the general election.
I mean, and one thing that I will say, and you all take a note of it, got the video. I want to thank President Donald Trump for making healthcare a center issue of 2020 again, by him declaring that they're going to repeal the Affordable Care Act and come up with some sort of a better plan in the next, 18 months? Sure. Thank you so much. Okay, one more question. Yeah.
I am disappointed that there was no mention of giving authority to those people who have the most to gain and lose. In other words, individuals with regard to the pricing. We have no availability of the pricing of anything. I'm a physician, and I know people don't, or they're afraid to ask the price, even afraid to ask me for the cost of what a visit would be. I'm retired, I'm a volunteer in medicine, I am seeing folks, and the people that I see who don't have insurance, may not have seen a doctor for 40 years. I mean, that's amazing to me in a modern country. So there is no preventative care, nothing for these people for that many years. And it's hard to change the trajectory of their health care. I haven't heard anybody talk about the knowledge of what everything does actually cost. I'm disappointed our discussion didn't point out that the insurance companies, because they get paid a percentage, are always going to be on the side of raising the cost of any procedure, of any benefit to a provider. They're always going to be on that side because they'll just raise the premium. On the side of the hospitals, I've seen hospitals grow to amazing sizes, duplicating all the care that every other hospital in the area has done to immense waste. And I think that those are questions that need to be addressed.
Let me respond to that by saying that, I mean, you're absolutely right. What is done globally can be done, should be done here, whether it's Medicare for all or something else. Dolores Sharansky bill, which I would encourage you guys to look at, is Germany has a law that says you cannot charge people more, people cannot pay more than 2% of their income in healthcare costs in a given year. And there are fixed amounts, and I'm a little vague on the precise details. I don't know whether that's insurance costs or out of pocket. I don't know precisely how it works out in that regard. Routinely, countries give to hospitals a defined amount of money that they can spend. Routinely, countries say regulate insurance companies so that they cannot do what you were talking about.
I'm sorry, who does the regulation? The hospital?
The government regulates. There is a government body that...
Well, there you've got it top down. Top down, even in the VA system, and I worked for the VA system. Top down is not always the best way to get things done. You lose innovation and you lose efficiencies.
I mean, and one thing that I will say just very briefly, I think we've got okay, your hand has been up. I will come and talk to you offline because, so we have heard in the Missouri House, every year since I've been there, a bill, I think it's called like Show Me Price Transparency Bill or something like that, which is exactly what it is. And the biggest pushback typically comes from the insurance companies and the pharmaceutical companies and what they call trade secrets. And basically saying that, the information that they use to calculate rates, prices, those sorts of things are proprietary. So so let's...
Just a comment. We haven't talked about the cost of America's military operations. And I think there's a big discourse within which the healthcare thing has to fit. And we talk about healthcare like it's separate. Now, you know, we have universal military presence because we have troops in 140 countries. Why the hell do we have troops in 140 countries? That debate is never run in the Congress because any military expenditure is approved. We do not limit military expenditure, but we are deeply suspicious of regulation, thanks to Ronald Reagan. So when you put those two together, as much money as you want for the military and big government is bad, that's what you're up against in the healthcare debate. And I think we need to broaden the debate to ask, you know, is it good for our health that we have troops in 140 countries? I don't think it is.
Well, I bet we could stay here and talk for several more hours to try to unpack these issues. But I just want to say thank you again to everyone for being here. Let's give our parents.
And I just want to remind people that if you want to
pick up what we stand for, which is a momentum list of our issues. And you can also sign up to be a member of Momentum and get our weekly alerts. Also, I want to thank the Healthcare Committee, Dan Lahaki and Jane Zenny, the new co-chairs, and the speakers who helped get this off the ground and came up with the idea and brought it to fruition. And I think it's been a really exciting discussion. I feel like my brain is just full of whatever. I mean, I just like, wow.
What's going to happen to the